Good day, I'm Theodore Henry, and this is your JIS News for Tuesday, August 18. The state has extended the quarantine period now in effect for communities in St. Thomas and Clarendon until September 2. Since August 6, Sandy Bay in Clarendon, as well as Bamboo River, Church Corner, and Lower Summit in St. Thomas have been under quarantine. At a press conference Monday, Prime Minister Andrew Holness said the extension became necessary as the authorities were seeing a rapid increase of positive cases in and around the areas under quarantine. Mr. Holness also announced that the curfew hours for St. Thomas had been revised and will now run from 7 p.m. to 5 a.m. the following day, starting August 18. The national curfew, which still applies to all other parishes, remains 11 p.m. to 5 a.m. Meanwhile, public gatherings in St. Thomas will also be impacted by the revised protocols.
Which will be in the new order. There will be no funeral services at churches. Unfortunately, wedding ceremonies would be affected as well. Entertainment would be affected as well, and civic services would be affected. And this is for the next 2 weeks.
To date, the Ministry of Health and Wellness has conducted 300 home visits and collected 700 samples in St. Thomas. Of that number, 89 samples have tested positive for the novel coronavirus, including 45 outside the quarantine area. Scores more have been symptomatic and are now awaiting their test results. Over in Clarendon, Health Ministry personnel have visited 900 households and interviewed over 2,000 persons. So far, 22 persons in the area have tested positive for COVID-19.
Additionally, approximately 20 communities within the parish of St. Thomas have been impacted with new COVID-19 cases. These communities span the entire length of the parish and therefore indicates a sort of community transmission, if you will, that are some epidemiologically linked, others not, and hence the need for a greater level of alertness and concern.
Meanwhile, Health and Wellness Minister Dr. Christopher Tufton says several communities in Kingston and St. Andrew are being monitored due to a spike in the number of active COVID-19 cases. The communities are Duaney Park, Patrick Gardens, Pembroke Hall, Coreyville Gardens, New Haven, the Halfway Tree area, Hewenden, Arlene Gardens, Malines Gardens, State Gardens, Zadie Gardens, Constant Spring, Barbican, Meadowbrook, Havendale, Delacree Park, Olympic Gardens, and Waltham Gardens. Residents in these communities are being asked to exercise even greater care and vigilance during this period. At Monday's press conference, Dr. Tufton said the communities are being monitored as they've shown increases in COVID-19 cases with sources which cannot be traced or linked.
I don't want the public to interpret this as having multiple cases. It really is an issue of cases that are presenting, which now requires contact tracing and the possibility, the chances of other persons being contaminated based on the movement of these individuals in these communities is a very real one. And the history of the virus suggests that that is the case.
Still on health, expectant mothers are being encouraged to visit antenatal clinics at the earliest stage of pregnancy. Coordinator of the Program for the Reduction of Maternal and Child Mortality, PROMAC, Dr. Simone Spence, has issued the caution. Dr. Spence says the health conditions brought on or worsened by pregnancy need to be identified as soon as they present, so adequate treatment can be administered to bring about the best outcomes for both mother and baby.
The health system can only do its part once it is that you have sought to access care. So, what we want to do is to have women play that proactive or have that proactive approach in terms of ensuring that they're healthy to be pregnant. And then once you are pregnant, to ensure that you're having your clinic appointments, keeping those clinic appointments so you can be appropriately monitored.
Expectant mothers are able to access these services at health centers without having to visit a hospital. A $52 million virtual training and motorcycle simulation program has been opened in Westmoreland to help reduce road fatalities. Minister without portfolio in the Ministry of National Security, Matthew Semuda, says the program will sensitize participants about the road codes, types of motorcycles, their parts and controls, as well as defensive riding.
Due to these high number of motorcyclist fatalities in Westmoreland, The ministry and its stakeholders have decided to pioneer the first motorcycle simulation program here in Petersfield.
Minister Samuda was speaking at the recent launch of the Outreach and Training Program and the installation of a motorcycle simulator. The virtual platform will provide reenactments of accidents and solutions to avoid collisions. The reality training will be delivered under 4 modules, with the use of virtual reality headsets to accommodate persons who are unable to read and write. The program is being supported by the National Road Safety Council. The Motorcycle Operations Level 1 program will begin in September as part of the curriculum of the Heart Trust NSTA. And finally, persons registered with the Jamaica Council for Persons with Disabilities, JCPD, may apply for benefits on the government's COVID Care program. This applies to persons who have been registered with the Council from March 31, 1973 to June 30, 2020. Successful applicants will access one-off temporary grants to cushion the economic impact of COVID-19. Executive Director of JCPD, Dr. Christine Hendricks, says this grant is available to persons with disabilities aged 0 and upwards who are unemployed or not formally employed. Individuals who have already benefited under the CARE program should not apply. Application is now open online at wecare.gov.jm, and the deadline for submission is now August 31, 2020. Applicants will need to provide their name, address, a valid tax registration number, and banking information. Persons may visit the JCPD as well as all parish offices of the Ministry of Labour and Social Security, the Jamaica Society for the Blind, Jamaica Association for the Deaf, Jamaica Association for Persons with Intellectual Disabilities, and the Combined Disabilities Association. And that's it for JIS News Today. I'm Theodore Henry. Thanks for watching.